Traditionally, qualitative lung ultrasound has involved a subjective characterization of the lung based on the identification of artifacts, analysis of the pleura, and visualization of other abnormalities like pleural effusion or consolidations. This qualitative approach helps in determining the underlying cause of acute respiratory distress. However, the researchers point out that a quantitative approach can be particularly helpful in monitoring patients during treatment. In human medicine, several scoring systems have been developed to objectively measure the extent of aeration loss. The study mentions that various patterns can be recognized during lung ultrasound. A normal lung, described as an A profile, is characterized by horizontal artifacts known as lines, which should be associated with lung sliding, indicating normal movement of the pleural surfaces. In contrast, AB profile, often associated with interstitial syndrome, is defined by the presence of at least 3 vertical artifacts called B lines in a single quadrant, suggesting a decrease in lung aeration depending on the extent to which these artifacts affect the pleural surface. Other patterns include an irregular pleural line, which is a hypoechoic band with an uneven boundary and can indicate mild peripheral loss of lung aeration. A tissue-like pattern, also known as alveolar syndrome, signifies a complete loss of aeration in the affected area due to consolidation or atelectasis. Finally, pleural effusion is the collection of fluid in the pleural space, which can have various appearances on ultrasound. This study provides compelling evidence for the excellent intra- and inter-rater reliability of the lung ultrasound score and pattern identification in dogs and cats. The findings offer a strong foundation for the wider adoption of this lung ultrasound scoring system in veterinary emergency medicine and intensive care for both diagnosis and, importantly, for monitoring the progression and response to treatment of respiratory diseases.